Hello everyone, my name is Phạm Văn Thị. I am a PhD student in University of Tojama. Today I am very pleased to be here and on behavior of research team. I would like to present this poster on the topic investigate the relationship between high-level microcephaly stability, PD-L1 expression, and histopathological characters in Vietnamese patients with gastric cancer. Firstly, introduction. Microcephaly stability (MSI) is an important molecular subtype of gastric cancer caused by IMBE DNA mismatch repair programmer that negate one PD-L1 is another promising biomarker indicating a potential immunotherapy response. PD-L1 expression correlates with MSI status and favorable prognosis in gastric cancer. Therefore, this study aims to determine the frequency of MSI gastric cancer and characterize the association between MSI status, PD-L1 expression, and clinical pathology features in Vietnamese patients. Secondly, materials and methods. We conduct a retrospective descriptive cohort study analyzing 87 gastric carcinoma patients who underwent gastrectomy with lymph node dissection at Military Hospital 103. The acquired data were evaluated by statistical analysis to assess the correlation among the various indicators. About the result, Table 1 the frequency of high MSI and PD-L1 expression. 13.79% of tumor exhibit high MSI status and a loss of expression of two immune markers MLS1 and PMS2 or own four immune markers. The expression rate of the PD-L1 marker were 32.2%, with 46% of cases having a CPS score more than 1. Table 2. The correct correlation between MSI high MSI with the PD-L1 marker CPS. Most high MSI patients were positive for PD-L1 and have a CPS score more than 1. About Figure 1, association of MSI and clinical pathological features. The high MSI status were significantly associated with neuroinstatial subtype, moderate differentiation, V tumor 3 of tumor invasion, and tumor infiltrating lymphocytes, TILS, with p-value under 0.05. Figure 2 and 3 are illustrated images that I took in the research. This image shows about PD-L1 expression and MSI status in immunohistochemical. Table 3. Association of clinical pathological features and PD-L1 expression. Lymphatic invasion demonstrates a correlation with elevated TPS, while intestine classification were associated with higher CPS values. In the present state study, we conduct motivation heuristic regression analysis to uncover potential risk factors for microcellular instability, MSI, and PD-L1 expression in gastric cancer. Our principal finding success as patient demonstrates BD3, BDT3 invasion, Norand classification in cystic type, and moderate differentiation tumor present a necrosis, high tumor infiltrating lymphocyte and tumor with TVS more than 1% and CVS more than 1% may exhibition an average risk for MSI. Likewise, patients presenting with lymphatic invasion and mixed stripe by Norand classification potential face a higher risk for PD-L1 expression. Finally, conclusion. Our research suggests that high MSI status deny a distinct subset of gastric carcinoma with specified clinical pathological features. PD-L1 expression appears to be associated with parameter indicative of more aggressive disease. The finding underscores the potential utility of biomarker-based stratification in guiding personalized therapeutic approach for gastric cancer patients. I'm honored to present this research paper at a poster. I wish the conference great success.